Welcome to Translational Conversations from Model to Medicine, a series of discussions between animal and clinical researchers on the important interplay of their approaches for making scientific advances in biomedical research. Through this series, we highlight how both animal and human studies are essential to the understanding the origins of illness and the development of novel, impactful, effective treatments, while we explore how researchers from both sides can collaborate and support one another. I am your host, Dr. Rachel Perleski, a neuroscientist and the 2025-2026 Brad Fellow. We're very excited today to be joined by Dr. Ned Kalin, Hedberg Professor and Chair of the Department of Psychiatry at the University of Wisconsin-Madison, and Dr. Melissa Brotman, Chief of the Section on Neuroscience and Novel Therapeutics at the National Institute of Mental Health. Dr. Kalin is a translational researcher studying childhood anxiety as it relates to brain function in the nonhuman primate model of rhesus monkeys, and Dr. Brotman is a clinical researcher investigating the brain basis of irritability in youth and development of treatments for severe irritability. So again, thank you both for being here and joining in this discussion. I'd like to begin by hearing you each describe in your own words what the major goals and objectives of your research are. And with that, why don't we have Dr. Kalin go first?
Well, thank you, Rachel. It's a pleasure to be with you and to have this opportunity. My work is very focused on trying to understand why some individuals develop anxiety and depression and others don't. And that takes us back basically to a developmental perspective, which is critical from the standpoint of thinking about most psychopathology, but in particular, psychopathology that has to do with internalizing disorders like anxiety and depression. And my work is very translational, as you mentioned in your introduction. We work with rhesus monkeys, a non-human primate model of anxiety. And we also work now over the last 12 or so years with young children who are at risk to develop anxiety disorders or have anxiety disorders. And the major focus is really to, as I mentioned, understand the developmental factors, especially the factors that have to do with early life that lead to the likelihood of an individual developing these types of problems. And ultimately, the goal for all of us is to think about how we can use that information, our better understanding and deeper understanding of brain alterations and all the factors that come together in a way that we can develop new treatments. And I think when we hear from Melissa, you'll get a really nice example of a new treatment that she's developed based on probably some animal work as well as human work.
The overarching goal of my work is to develop treatments for youth with psychiatric disorders. And I'm particularly interested in non-pharmacological, that is, learning-based treatments. I specifically focus on kids with very severe anger and irritability. And the main kind of one question is, how do you develop a treatment for psychopathology? You have clinical instinct, you have theory, you have multiple ideas. My fundamental mode is guided by mechanism, by understanding the brain, by understanding causality. And that's why it's so important to work with people like Dr. Kalin and really understand the neural circuitry so we can understand kind of the causal pathway. So it helps me understand what learning principles I should be implementing to target what might be going awry.
I'd really like now if you guys could each take a moment and think about, what does your model, sort of the human approach versus this animal approach of research really offer that's unique specifically to understanding psychopathology, especially within this developmental framework that you guys both work on. Ned, we can start with you again.
Sure. So in our non-human primate model, we work with young monkeys that are in the pre-adolescent phase of their development. And the reason for that is because that's a period of increased risk for the standpoint of lots of types of psychopathology. And what we've been able to do is to understand the brain circuitry through neuroimaging that is important in mediating extreme anxiety, for example, in young primates, which maps onto young humans, young children. And that circuitry is involved with cortical circuits and prefrontal circuits and limbic circuits. And we've also been able to look at the molecules and gene expression in these different regions that we've identified as being critical circuits to understand which genes may be involved or altered. Now, the non-human primate model allows us to do that in ways that can't be done in humans. For example, we've developed a brain bank of animals that have been fully phenotyped, and then use that brain bank to look at the molecular biology, the gene alterations in animals that have high levels of anxiety. But one more thing that I'd like to add is that when we get down to understanding mechanism, the non-human primate model and all animal models can be really informative in relation to human work. And basically, most of the work that's done in humans, not all of it, but most of it, when they're looking at psychopathology or biology underlying that, is associational. It's very hard to do mechanistic studies in humans. But in animal models, we can. And for example, in the non-human primate model that we have, we've been able to alter genes and their expression in the amygdala. And by so doing, make animals that are highly anxious much less anxious. And we've also been able to modify the activity of circuits that we've identified as being important using methods called chemogenetic methods, which are commonly used in rodents, but have not been so commonly used in non-human primates. And those experiments allow us to really pin down the parts of the brain that are underlying high levels of anxiety or underlying other features of psychopathology. And that then gives us leads about specific mechanisms that may lead to new treatments.
Melissa, what would you say then are the sort of unique approaches or unique advantages to studying psychopathology in human beings that sort of is complementary or is especially an asset when it comes to understanding these disorders?
Similarly, what I was thinking, that there really is kind of a gradient of mechanistic understanding, with animal researchers facilitating a much more kind of granular approach and understanding. Whereas on the clinical end, by working with humans, I can ask them about their individual subjective experience. I can hear their how they describe what they're feeling. I can really operationalize the pathology as it presents in a human, in a child, in an adult. What their needs are, what their problems are, what needs to be addressed, and of course, from a treatment perspective, we can assess efficacy of a treatment and ask the individual if they feel like they've gotten better, and reflect on that and talk to them about it. So it's really kind of integrating the two, where you get a kind of a broader, more comprehensive understanding of the mechanism and the human experience.
So maybe if I can just add a little bit, Rachel, to that, I want to emphasize that the animal models are modeling specific aspects of psychiatric illnesses. But as Melissa, I think, was pointing out and alluded to, they cannot model specific diseases completely. And obviously, what's so important about psychiatric illnesses is the subjective experience, which we cannot understand in animal models. But we can use animal models, again, to get at very specific types of mechanisms. So one example might be that in Melissa's work, she may identify a brain region through neuroimaging that is highly associated with symptoms and also maybe is related to treatment response. But she doesn't really know if that brain region is at the heart of all that or if it's just associated with those changes. We can go into the animal model and, based on what she's learned, ask the question, if we modify the function of that brain region, how does it impact behaviors that look like or associated with, we think, what she's dealing with in her kids?
Yeah, so I want to talk a little bit more about this topic. And I think that you guys are in a unique position, which is that you guys do sort of have active collaborations and you've worked together on projects in the past. And I wonder if you guys could speak a little bit more to sort of what the process looks like in terms of how animal and human researchers kind of work together and use their research to inform one another. Ned, you used a sort of nice example here. But speaking in a little more depth of, like, how do we facilitate a sort of translational back and forth? Is it as simple for some researchers as reading animal papers and using that to inform research questions? Are active collaborations a more prosperous or informative way of going forward? Is it sharing data? Like, what are your thoughts on sort of the best way to engage in this translational approach between the two sort of sides of these models?
I actually have a story to tell that I don't think Ned knows. And it occurred to me how apropos this story is, and how full circle this whole moment is. So there was a meeting down at NIMH with Tom Insel organized it. It was around 2009 on RDoc. You came down to Bethesda. We were on the Executive Boulevard, campus part. Danny was there. There were a whole bunch of people there. I was a postdoc at the time. I was in the peanut gallery, just kind of watching from behind. And Ned, you were talking about the human intruder paradigm, okay? In the context of RDoc and negative valence emotional states, and you were talking about the freezing behavior when it's a more ambiguous threat, and the barking behavior. And I actually went to talk to you about it afterwards, because in hearing about that study, that non-human primate study, and this kind of threat stimuli that elicited both kind of anxiety phenotype behavior and related threat stimuli that elicited anger behavior, that was the first time I, in my mind, linked the relationship between anger and anxiety, which then kind of percolated for another decade. And then that is how I ultimately came up with my new treatment idea of exposure therapy for anger, because that connection kind of set me going down a kind of a bunch of literature reviews in understanding the circuitry of anger and fear, and how they're similar and how they're different. And so that's a long answer to your question, which is, I think you have to kind of be in the room and hear it, and go to talks. I'm sure I had read things before, but there was something about the in vivo kind of understanding for me that I don't think I would have made that connection just from reading the paper itself.
I think this is a great example of how it can work really beautifully. Melissa gave the early history, but then in between that and now has been a very rich and enjoyable and fruitful collaboration between her and me, and her lab and our lab, including, Rachel, as you know, opportunities for students to go back and forth, to learn more and all that. And most importantly, all of us have the same goal, which is how can we help people who are suffering, reduce that suffering, and ultimately prevent it. And, I think what's so exciting about all of this is, Melissa has not talked yet about, she talked a little bit about the therapy she developed, but having the opportunity to develop a new therapy that's impactful is really important. But in my mind, what's even more important is having a neuroscientific theory that has guided that development, and so that you can test not only the sort of behavioral intervention, but you can also test it at the level of the brain. And that then leads to all kinds of possibilities about thinking about how we can impact the critical brain circuits that Melissa has identified. And that's where you come back to the animal model frequently, where you can experiment and manipulate. You can try new types of medicines or molecules or interventions that would be harder to do in kids, especially early on in the development of these things. And so I think that's a really nice example of how you can, and how we have gone back and forth and how fulfilling it's been both personally and scientifically.
And it's iterative insofar as, so, as Ned alluded to, I developed a psychotherapy, which essentially is an exposure-based treatment, which grows out of anxiety, OCD, PTSD work, where you expose an individual to anger-inducing events, to then teach them skills to be able to kind of regulate that emotion in the moment. And we do imaging pre and post to try and understand some type of causal pathway, which then we need the kind of more specific granular studies to really get at causality. And then by understanding that, it's iterative in that it can help me then augment something that I know works, and I think I kind of know how it works. But by then, understanding it's actually this particular region or this particular circuitry that we really need to focus on. So if you additionally work on such and such skills, some inhibitory control skills, which we know are could be targeted in this same region, and it kind of helps you continue to hone and make the treatment more effective and maybe make it work faster or not need as many sessions from a psychotherapy perspective.
Yeah, I wonder if you guys, because you guys have both sort of mentioned the understanding of the neural circuitry in the animal models and how that can help inform treatments in the human models. And I wonder if you could speak a little bit more about that idea and how, what is it that we gain from an understanding of neural circuitry when it comes to developing treatments, right? So how do we use that to develop new treatments? Are we trying to target regions specifically and alter how they function in the clinic? Or is it allowing us to get a better profile of what that psychopathology looks like in the brain, which can help us better track how treatment progresses? Can you guys talk a little more about that idea?
I can start and say a few words about that. Our ultimate goal is, in my mind, two big goals, and these are the things that are most exciting to me. One is, what you've heard a lot about, which is a personalized medicine approach to our treatments, because most of what we deal with is pretty heterogeneous, even when we call it one thing. An example might be in Melissa's kids who are aggressive or having impulse control problems. Some of that might be related to some anxiety that they have. And in other kids, it may not be related to anxiety, it may be related to something else. And so thinking about the circuitry and the molecules in the brain in those circuits that have to do with different symptom patterns, for example, can be very informative when we start thinking about specific types of treatments. The other part of that is that it can be very informative, obviously, I think, from the standpoint of guiding those treatments. So which kids or which people should get one treatment and which people should get another. Let's say that we find out that one subtype of Melissa's kids has a lot to do with amygdala overreactivity, and another group has to do with a deficit in the DLPFC, or the dorsolateral prefrontal cortex, from the standpoint of having executive function and inhibitory control. And they're not mutually exclusive. But let's just say that there's one subtype that's more like that, another subtype that's the amygdala way. You would think, based on what we know about the neuroscience of all this now, from what we've learned of decades of research from animals, is that Melissa can come up with some strategies that would be quite different for those two different groups. So I think we're not fully there, but we're getting there. And I think Melissa's work is an example of that. We haven't talked about medicines, but when we think about the genes that are involved, or the types of molecules that are involved in the different circuits, we can think of medicines that might be very helpful. One outgrowth from our work, which is very early and very experimental, based on our studies in monkeys and also in children, we've identified alterations in white matter, and other people have found this as well. And it tends to be in certain circuits, and it's white matter, which is the insulation around our axons and really helps us have a really efficient neurotransmission, seems to be decreased. And one of the former students in our laboratory, Nicole, who and I came up with sort of the idea that maybe if we found a medicine that would help promote white matter growth, that might be something that we could try. And in our non-human primate model, we tried that, and we got some early hints that might be, and I'm saying might be with a big might be an approach that might be fruitful. So that's just some of the examples of how we can think about this.
I agree completely. I mean, the first thing that came to my mind was this kind of precision medicine approach that, again, clinical phenomena are extremely messy. And so I could have 10 kids in the clinic that present with similar symptoms, but they could be being driven from kind of different circuitry dysfunction, such that if there was some way I could kind of triage what to target first in which kids, we could just be much more efficient and effective in getting kids better, faster.
These are some really great thoughts. I'm enjoying this discussion and thoughts about treatment a lot. And I want to shift gears a little bit now and talk a little about, and we'll start with you, Ned, for this topic, which is what do you think are the most common or the most problematic misconceptions about animal research as it relates to anxiety or psychopathology or, psychiatric illness in general? And what would you like to say to sort of counter those misconceptions? And what do you think it's important for people to understand sort of about the research process with animals?
Well, I think in broadly and in general, and regardless of the animal model, incredible discoveries have come out of work with animals. And this is in many fields of medicine, including immunizations and cancer research, and just completely across the board. And in psychiatry, it's a little bit more difficult to use animal models because, as Melissa, nicely emphasized, the experience of patients that have psychiatric problems are subjective, and we still have not yet identified biological markers, for example, neuroimaging markers or EEG markers um, that are valid in a way that they're robust enough to predict, which individual is going to have which type of illness. But we're getting there. And the animal model work in psychiatry has really helped us move forward in many ways. Anxiety is a great example, and I think it's probably one where we can really be confident that the animal model work has been translated to humans. And that is because the model in monkeys and also in rodents is very similar to what we see in humans from the standpoint of the expression of anxiety and also the circuitry that's involved. So I think that many people have underestimated animal research from the standpoint of its contributions. Some people have really said, this issue of a subjective experience can never be modeled in an animal. So what are you doing? You can't really model anxiety or depressive disorder or social anxiety disorder, for example. That's all true. You can't model that. But what you can do is you can look at aspects of that from what we've learned from the clinic and what we've learned from imaging studies and investigate the mechanisms that underlie that and really use that to leverage new ideas about treatment that we've been talking about. So that's one thing. The other point that I want to make is that, there's a world of folks out there that love animals, and I'm one of them. And some of those folks, not all of them, but some of them really, just can't see the value in using animals experimentally. And what I want to emphasize is that we are extremely careful and regulated in relation to how we use animals. We're very careful about using the smallest number of animals for an experiment. And also we're extremely careful about any distress or pain that the animals feel. And like human studies that have to go to an IRB for approval, our animal studies go to a committee made up of multiple individuals, including folks from the community, to oversee the work that we do. So that, we're very cognizant and mindful of issues like that and are only doing these experiments if we believe, and this is my belief, that these experiments are going to contribute to humans in a way that it's going to ultimately reduce human suffering. And that's what I think is so important about this. And I think that the more that we work translationally, the issue that you're trying to really emphasize here, the more likely it is that the animal work will be highly relevant to humans.
And yeah, and to Melissa, just to speak to your own experience, I would love to hear sort of, what misconceptions maybe you had about animal research earlier on in your career that have changed or shifted as you've, had these collaborations with Dr. Kalin or have just had more time and exposure to different kinds of animal studies.
While I'm a clinical psychologist and my interest is developing treatments, I've always been aware of the need to understand mechanism and causality. And I guess what I would say as a human clinical researcher, Ned alluded to this, all the work we do is correlational. We cannot do it alone. It's literally not possible for us to continue to develop new and effective treatments without partnering. And if we want to, really move the needle on human suffering and psychiatric disorders, we have to work together. We need the translational partnership because you just cannot causally manipulate things in humans in a way that you would need to in order to understand how and why the treatment's working.
Rachel, if I could make one other comment that I was
Absolutely.
thinking about that I really want to emphasize. I've been talking broadly about animal research and animal models, but I do want to focus a little bit on the non-human primate research and just help people understand why that is such a critical piece of the work that has to be done. The non-human primates, especially in relation to psychiatry, are very similar to humans in many respects, behaviorally, from the standpoint of how they rear their young, the way that they experience stressors, but as importantly is the way that the brain is structured, which is very similar in monkeys and humans and not so similar in rats. And more specifically, the part of the brain that we're so interested in is called the prefrontal cortex, as you know. And that part of the brain is the part that helps us regulate our emotions, our feelings, our thoughts, and how they all fit together when we get confronted with a challenging situation. And we believe that that part of the brain is so critical to those things, but also very much to our subjective reporting of what we're experiencing. And so the non-human primates really allow us to look at the brain at that level and to look at the circuits that are so analogous to humans. That always, of course, because the non-human primates are closely evolutionarily related to humans and much closer than other species like rodents. Now, the rodents' work has a very important place as well. I don't mean to in any way diminish that work, but there is a very special place for the non-human primate work. And the reason I wanted to emphasize that is because it's also an area where many people are concerned. Animal rights people are concerned about non-human primate work frequently. And also, I think even at a political level now, unfortunately, there's some threat related to continuing to do non-human primate work.
Yeah, this is a really great segue into sort of the next question that I have, and I think is something I'm interested in. And there's no right answer here. I think we're all kind of figuring this out. As you sort of mentioned, it's a somewhat difficult time for animal research. I think there's a lot of confused perspectives, misconceptions out there about what animal research is and what its role is in biomedical research. And so I'd like to hear from you both about what you think clinical researchers can do, clinicians or non-animal researchers can do, in addition to animal researchers, to help support and advocate for animal research, sort of during this period where things seem to be a little bit more people seem to be a little more resistant to animal research.
I think from a clinical perspective, clinicians often have really strong relationships with advocacy groups. And I think that's an untapped or less tapped opportunity. I think clinicians I'm thinking about this now. I give talks to advocacy groups. I interact with patient groups, representatives. I think highlighting the role that animal research plays in developing the treatments and in helping patients and their families who are struggling. I think talking kind of from a grassroots perspective of education and perhaps having clinicians do it, clinical researchers, that is kind of one opportunity I see. That's kind of the first thing that comes into my mind.
Yeah, I definitely agree with some of the things that Melissa has said. I think it really is, the onus, I think, is on us as scientists and clinicians to be very forward about the value of the work that we do. Because it's not always evident to the public, and especially these days where there's so much stuff flying around about the lack of value of what we as scientists believe are critical components to the scientific method and process. And so I think, each of us have to own up and take responsibility for and be active with the groups that Melissa is talking about. Rachel, I commend you for doing what you're doing, because I think that this is exactly along those lines. And also, I think it would be important for the viewers of this to also have the link to Nakul Agarwal's essay or commentary that is, if it hasn't been, will soon be published in Neuropsychopharmacology, that really specifically addresses this and is a call for scientists to be more active, both with advocacy groups and, as he points out in that commentary, to think about earlier ways of making the point and emphasizing the importance of all this with children in their schools, doing fun activities, visiting the schools, all types of things like that. So I think we all need to double down right now on our advocacy. And again, I want to thank you, Rachel, for what you're doing in this regard.
Well, thank you guys. Before we sort of wrap up and close for today, I just wanted to sort of open the floor. If there were any other thoughts or perspectives or points you guys wanted to make or touch on before we kind of wrap up today in our discussions.
It's one of the unfortunate things is that there are many non-clinical researchers who have never, really seen a patient or have not had the type of interaction that we're talking about today between Melissa and I. And so I think, this thinking about ways to get people together, as Melissa was saying, in the same room, and really sort of forcing some of those interactions, I think is another thing that we can think about doing.
Well, this has been such a great and really enriching discussion, for me and hopefully for everybody who is watching or listening. And I really appreciated hearing your perspectives today on the importance of both animal and human models and understanding psychopathology and developing novel treatments. So thank you, Dr. Brotman and Dr. Kalin, for your time, openness, and invaluable insights. And thank you to everyone who's watching or listening as we've been learning more about how these parallel research avenues take us from model to medicine. So be sure to tune into our future episodes as we continue these important translational conversations. And until next time, remember to stay curious, intentional, and thoughtful in all your pursuits, and especially in research.
This Lab Rat Chat special series, Translational Conversations, is made possible through support from Biomedical Research Awareness Day, a program of Americans for Medical Progress, and the American College of Neuropsychopharmacology.